Edward Castellano. I'm a physical therapist, and my subject is Benzi. I'm going to demonstrate joint mobilization of the hip, the knee, and the ankle. The hip, particularly in our case scenario, we have a patient that is have a 50% movement on the hip extension, as well as in the abduction, and also 25% on the knee flexion, and only 50% movement on the ankle dorsi and plantar flexion, as well as eversion. So I'm going to start with a hip extension. I'm going to have my subject here in prone position. I'm going to place a towel under the ASIS joint, ASIS, okay, right there, and can you move here a little bit? Alright, so put this in my good position. Alright, so for the hip extension, what we're going to be doing is an anterior glide of the femur out of the acetabulum. Okay, so I'm going to position the knee into 90-degree position, and I'm going to palpate for the trochanter, which is right here. Okay, so I'm going to hold the patient's knee like this, just to stabilize it, and my mobilization hand will be on the joint here. Okay, and we'll look for the limitation. Okay, right there, and I'm going to grade it. Grade 1. Okay, that's small amplitude. Grade 2. Larger amplitude. I'm doing 10 oscillations twice. Second 10. Grade 2. Grade 3, larger amplitude towards the resistance. And I'm doing the physiological extension of the hip while doing my grade here. And grade 4, grip into the resistance. Okay, right there. Okay? Alright. So this is basically the position is with hip flexion, abduction, and external rotation. But for patient have an abduction limitation. So like in this position, I'm going to be on a joint line here. Okay? Alright. So I'm going to use basically going to anterior glide. And I'm going to do a physiological abduction here. Okay? Okay. Now I can grade it. You okay? That's grade 2. Grade 3, also larger amplitude with my physiological abduction. Grade 4. Okay. Okay. Go to the knee there. Okay. All right. And we'll use a little bit of a pillow, towel. We're going to work on his right knee. Can you get it? Okay. Now what I'm going to perform is posterior anterior glide to increase flexion. Alright? So I'm going to be on the joint line here. My other hand will be supporting the distal femur, and the other one is my right hand will be placed on the proximal tibiofibular, where I can apply the force and a glide right here. So we're doing a posterior glide that way. So grade 1. Okay. Now grade 2, larger amplitude. You okay, man? Grade 3, larger amplitude to the resistance. And grade 4, small amplitude up to the resistance. Okay? The patellar movement, which is limited also towards the inferior glide and the medial glide. You can do this separately, or you can do this together or combined. So I'm going to demonstrate the separate approach. Okay? What we're going to do, right. I'm still going to use this bolster so that the knee will be bent a little bit. I'm going to assess the movement of the this bolster. I'm going to perform the inferior glide and the medial glide of the patellofemoral joint. It's basically because there is a 25% limitation. So I have the knee position approximately about 25 degrees. So I place a pillow under the knee here, under the thigh, and I'm going to assess the patella, which is actually right here. As you can see, it's just moving really well. Okay, inferior and superior glide. Okay. Now, for our case scenario, the patient has a limitation towards the inferior glide. So what I do is I use the web of my hand right here, and I'm going to cup the patella right here, and kind of like, you know, holding the patellar bone. All right, and I'm just going to help it with my right hand. Okay, I'm going to look for the limitation. Okay, there's limitations right there, and I'm going to grade this one. Grade 1, small amplitude. Grade 2, larger amplitude. Available range. Grade 3, larger amplitude up to the range. Grade 10. And then grade 4, up to the range, small amplitude. Okay, now for the medial glide, I'm just going to use my thumb and assess it to the limitation. Okay, and there, and I'm going to grade it from here. Grade 1. I'm just using my thumb to apply this motion. Grade 2, larger amplitude. Grade 3, larger amplitude towards the resistance. Grade 10. Grade 4, small amplitude to the resistance. Okay, All right, that's for the again, the patient is in a supine position. That is my preference, and I have the ankle basically suspended up here with a towel roll. Okay, so we're going to perform a downward glide so that we're going to increase the patient's dorsiflexion. So I'm going to support the proximal tibiofibular right here, just above the malleoli, and I'm going to just position the foot into neutral position, and I'm going to cup the talus right here. Okay, so just in neutral positions a little bit with my finger. Okay, and then I'm going to apply this posterior glide. Since there's a pain there, we're going to start with 1. Grade 2, larger amplitude. Okay, so a towel roll on the lower leg here. Again, the position is I'm going to support with my left hand the distal tibiofibular, and I'm going to push this. And you get it tight here. All right, and I'm going to cup the calcaneus. I'm going to apply the mobilization since there is a pain, so we're going to apply just grade 1 and grade 2. Okay, grade 1. Small amplitude. Grade 2. Larger amplitude. Okay. All right. Now our subject is in the side lying position, and again, I prefer this position to apply the mobilization. All right. So again, I'm going to support the distal tibiofibular joint, and I'm going to cup the talus and calcaneus, and then apply that motion. Physiological eversion. Okay, so I applied grade 1 and grade